Hello, welcome to Ezra Medical Center's Health Expo. This expo is intended to focus on men's health. I am Dr. Jeffrey Teitelbaum, the medical director and a member of the medical staff here at Ezra Medical Center. Why focus an expo on men's health? The reason is because men, as a group, disproportionately are less likely to receive preventive health services. Physical exams are the cornerstone and entry point to healthcare. Why get a physical exam? Number one, to establish care. It's important to have somewhere that you could call your medical home. Also, to ensure that indeed you are healthy. To detect health issues early, and for screenings. Screenings can be general screenings applied to all people at all specific age groups, or specific screenings based on family history or individual risk factors. There are many barriers to men getting preventive health services. These reasons are varied, and some reasons may include lack of time, fear of the unknown, fear of pain, image, and expense. So to encourage men to take advantage of preventive healthcare services, this short talk will briefly go through the physical exam highlights in hope that this will encourage men to benefit from these available services. What happens at a physical? You will be asked a lot of questions. You will be asked questions in regard to your past medical history, your past surgical history, medications you may be taking, including over-the-counter prescription medications, herbals, and vitamins. Do you have any allergies to food, medications, environmental allergens? You'll be asked about your social history, your family history, and you will be undergoing a thorough review of systems. A review of systems is a series of questions targeting the various body systems to ensure health in all body systems. Questions are asked in regard to your general state of being, your eyes, your mouth, your ears, your heart, lungs, gastrointestinal and musculoskeletal systems, urologic concerns, neurologic concerns, and psychologic issues. What does a doctor examine during a physical exam? A physical exam should be head to toe. There are specific screenings we do at different ages. From age 18 to 39, a BMI will be done. BMIs are a measure of height and weight taken into a ratio and put out into a number which gives your health provider information about your health. An ideal BMI for most people should be 20 to 25. Above 25 is considered overweight, above 30 is called obese, and above 35 is called morbidly obese. Each number should be based on each individual person's specific characteristics. Blood pressure. Blood pressure should be systolic under 140 and diastolic under 90. Sugar, fasting, should be less than 100. Cholesterol should be less than 200 fasting. We also do metabolic blood testing, immunizations, and whatever necessary referrals are needed. From age 40 to 64, we do BMI, blood pressure, sugar, cholesterol testing, metabolic blood testing, similar to what we said earlier. And we also start doing prostate cancer screening based on an individual's risk and colon cancer screening based on an individual risk at specific ages. We also do immunizations, and we'll give whatever necessary referrals are needed. From age 65 and above, BMI, blood pressure, sugar, cholesterol, metabolic blood testing, and we start checking for heart disease. For those men that smoke above 65, we do an abdominal aortic aneurysm testing. We also check for osteoporosis if there are risk factors, and colon and prostate cancer screening continue based on an individual's risk factors. Immunizations are given, and whatever referrals are also given. How does one prepare for their physical exam? Be prepared to discuss your issues. Bring them in advance. Know your family history. Know your personal history. Know your medications. Know your allergies. and expect to return for a follow-up visit. Having gone through the elements of a physical exam, we strongly urge each and every person to make an appointment for their physical exam. We at Ezra Medical Center have caring and qualified medical providers, friendly office staff, beautiful, clean, and comfortable facility. We accept most insurances. We have a sliding fee scale. We are multi-specialty for your convenience, and we are responsive to community needs and expectations. Thank you for listening, and we look forward to continue servicing our community as a whole and you as an individual.
Hello, I'm Dr. Goldstein. I'm Chief of Podiatry at Ezra Medical Center. I'm affiliated with Mount Sinai Hospital, with Columbia Presbyterian Medical Center, and with the New York College of Podiatric Medicine. The foot is the foundation of the body and therefore can have various effects on the entire body. Consequently, it is also affected by various medical conditions such as diabetes. You have all heard of someone who has lost their foot or had serious infection or has been hospitalized due to diabetes. And so today I'd just like to discuss the importance of a preventive foot exam. The risk factors of diabetic patients involve the four systems: the vascular system, the neurological system, the musculoskeletal system, and the dermatological system. A diabetic foot exam, which is recommended once every 6 months, involves examinations of varying systems. We check the circulation. Do you have any loss of pulses? Do you have decrease in capillary filling time? If so, we will refer you to proper vascular exam. The neurological system, we check, do you have any loss of sensation in the foot? Because this is one of the principal reasons why people develop ulcers on the bottom of their feet. In the biomechanical exam, we check, do you have any foot problems, such as bunions, hammer toes, calluses on the bottom of the foot? In the dermatologic exam, we check, do you have any skin lesions, any infections, any ulcerations, any nail deformities? Although adults are usually more associated with developing a foot problem, the problem does not develop in adulthood. It is a problem that you have since childhood, and it's just not attended to and not noticed. Therefore, I would highly recommend that every child have a foot exam the same way they have an eye exam or a dental exam to check whether any problems are present and to address them appropriately.
Hi, I'm Dr. Schwartz, an optometrist at Ezra Medical Center. When most people think of an eye exam, they think of going to an eye doctor for glasses to check their vision, to make sure that they're able to see. That's not the only reason why you need an eye exam. The other part is the health of the eye. It is very important that the doctor does a full dilated fundus exam, which means they put drops in the eye and they check the back of the eye to make sure everything is healthy. There are many conditions that can be detected from this exam, especially in patients that are over 40 years old, such as diabetes, high blood pressure, high cholesterol, and glaucoma. For this reason, it is very important to schedule an eye exam, even if you feel that there's nothing wrong.
Hello, my name is Dr. Krinsky. I'm a doctor here at Ezra. I'm a general medicine doctor as well as a nephrologist, which is a kidney doctor and high blood pressure specialist. And I'm going to talk to you a little bit today about two medical problems that we see very frequently: diabetes and hypertension, which is also called high blood pressure. So first with diabetes. Diabetes is a problem that the body has with how it handles sugar. The body needs sugar in order to carry out its day-to-day activities. The cells of the body need to absorb the sugar in order to handle their day-to-day activities. And when they have difficulty doing that, other problems can come up. There are two types of diabetes. Type 1 diabetes, which is more unusual, is a problem where the body does not make any insulin. Insulin is the hormone that the body makes that allows the cells in the body to absorb the sugar the way they need to in order to work properly. So in type 1 diabetes, the body does not make insulin at all. Type 2 diabetes, which is much more common, is where the body makes insulin, but either the body does not respond to the insulin or the body makes too little of the insulin. In most patients, diabetes actually does not cause symptoms. Some symptoms that patients do have are needing to go to the bathroom frequently, and being very thirsty with very dry mouth. Patients with diabetes, because they don't have symptoms, very often don't even know that they have a problem, which results in them coming to see doctors when the disease is further along. The sugar, when it's not absorbed by the cells in the body, stays in the bloodstream and can actually cause injury to a lot of different organ systems, including the brain. You can have injury to the brain that includes strokes. You can have injury to the eyes that includes changes in your vision. It can affect the heart. It can affect the kidneys. It can have very wide-ranging effects affecting circulation to the arms and legs, causing infections, etc. If we catch the diabetes very early, working with a doctor to help you lose weight and eat properly, we can actually, in some patients, either slow down the diabetes and in some instances, even eliminate it entirely. People who are overweight, especially if they are what we call obese, meaning people who are generally 50 or more pounds overweight, that causes the body, for reasons we don't fully understand, to have difficulty handling sugar and brings about type 2 diabetes. Another thing that can bring on type 2 diabetes is physical inactivity, not doing exercise on a regular basis. In addition to that, type 2 diabetes has a strong genetic and family component, so that people who have diabetes in their close blood relatives are much more likely to have diabetes themselves or to develop diabetes. Finally, for women, if they have diabetes when they're pregnant, something called gestational diabetes, they are much more likely to develop diabetes as time goes on. The first test that can be done is called a fasting glucose test. This is a test where we draw some blood and send it to the lab and measure the sugar level after you haven't eaten for 6 to 8 hours. If the measured number comes back at greater than 125, you're said to have diabetes. People who have slightly elevated numbers, namely between 100 and 125, are said to have prediabetes, meaning that their body is having some difficulty handling the sugar, but it is not yet at a point where it is dangerous or needs to be treated. These people need to be careful with the amount of sugar that they eat and need to be monitored because they are at an increased risk of developing diabetes. The second test we can do is called a glucose tolerance test. This is a test where after not eating for 6 to 8 hours, you will drink a very sweet, sugary drink in a doctor's office or in a lab. And after 2 hours, they would check your blood and see if your sugar levels go up. The third test that we do, and this is the one that is most commonly done, is called a hemoglobin A1C. This is a blood test that measures how well your sugars have been over the last 3 months. And this test gives us a very good idea about whether or not a patient has had diabetes, not just today, not just last week, but over a more extended period of time. With this test as well, we can distinguish between patients who have diabetes, that being if their A1C is higher than 6.4, and those who have the prediabetes where they have a sensitivity to the sugar, but may not yet need treatment, and those are patients whose A1Cs are between 5.7 and 6.4. If you're diagnosed with prediabetes, you have to try to exercise more, lose some weight, and eat healthy. Try and have a diet low in processed sugars like candy. Try and avoid refined flour products like cakes and cookies. Try to have more fruits and vegetables, and try and have higher fiber foods. In addition, there is some evidence that says that if you are a smoker, that quitting smoking can improve your body's handling of sugar as well, and actually reverse or improve prediabetes. For those who have diabetes, how can we treat it? So the first steps that we take are those that we mentioned for prediabetes: weight loss, exercise, and a healthy diet. In addition to that, most patients with diabetes will need some medication to help control their sugars. These medications range from a variety of oral medications, pills that you can take once or multiple times a day, all the way to various forms of insulin, which is the hormone that the body is not making enough of that we had mentioned earlier. This can be given in an injection form to replace what the body is not making. As diabetes progresses in the patients in whom it progresses, many patients will start off with medications early on, but may require insulin as time goes on. What is high blood pressure? So the blood pressure that we measure is the pressure in the blood vessels throughout your body. There are two numbers that we measure with high blood pressure. The higher number, the top number, is called the systolic blood pressure. This measures the pressure in your blood vessels after your heart finishes squeezing the blood. So at that point in time, the pressure in your blood vessels is the highest it will be. The lower number, the bottom number that we measure with high blood pressure, is called the diastolic pressure. This is the lowest number of the pressure in your blood vessels, and this happens when the heart has completed relaxing. They are both important for your health, and they are looked at together to determine whether or not you have high blood pressure and whether or not it needs to be treated. So a lot of the statements I made earlier about diabetes apply to high blood pressure as well. Weight loss is very important. Exercise is very important. In addition to that, in most patients with high blood pressure, a diet low in salt can help control the blood pressure as well. For most patients, however, the cause of blood pressure is what we call idiopathic, meaning we don't know the cause. And it has a lot of genetic factors. And so most patients who have high blood pressure will require medications. Your doctor can speak with you about the various medications that are available to treat high blood pressure. A lot of them have other effects, side effects that can be either positive or negative depending on the patient. Very often we may give a blood pressure medication that may have 2 or 3 other effects that we may desire in this patient. The importance of treating these diseases early cannot be understated. If we can find these problems, diabetes, high blood pressure, early, we can treat them early, often requiring less medications in the long run and avoiding many bad complications. Seeing your doctor every year for a health visit while you are well, before you develop problems, is key to finding these medical problems early, treating them early, treating them more effectively, and avoiding long-term medical complications. This is Dr. Robert Krinsky from Ezra Medical Center. It's been a pleasure to speak with you today.